Paradoxically, global warming also increases evaporation, creating droughts, and leaves dry areas more parched than usual. Such has occurred this past year in many parts of the world. Stunning aerial photographs of Europe taken earlier this year of 2018 show a green earth, but photos taken in July show most of Europe is brown and parched. Most of Brazil is in a record long-term drought. South Africa has had such an extensive drought that Cape Town is almost out of water. The entire west of the U.S. is in a prolonged and serious drought. La Nina events, part of the cycle of southern oscillations for many years, contributed to regional droughts. Research suggests, however, that the frequency of extreme La Nina events has more than doubled as a result of unabated global warming. As the climate warms even more, the severity of droughts during La Nina will likely increase. Across the world, climate-generated droughts and high temperatures have created conditions, perfect conditions for wildfires. This 2018 summer and early fall, wildfires were out of control in nearly every western U.S. state. Thousands of homes throughout the western United States and huge tracts of land were burned to the ground. High in the Himalayas, Nepal has experienced devastating fires. At the same time, dozens of wildfires raged in Sweden, Finland, and Russia, many of them above the Arctic Circle. These cool northern countries have little experience in fighting such fires and almost no firefighting equipment. Fires also raged in the Mediterranean. This past summer, Greece had a record fire season. In Portugal, dozens of people were killed last year in record forest fires. Scientists contend that these record fires are caused by climate change. In short, the world is ablaze, and extreme fires may become the new normal. Recently, the terms fire tsunamis and fire tornadoes have been frequently presented in the news. Fire tsunamis are walls of fire that generate their own weather systems and create high winds. These walls of fire can engulf an entire town in minutes and are extremely dangerous for firefighters. Such firestorms generate towering pyrocumulus clouds that can cause thunderstorms, high winds, and lightning over dry terrain. These storms can also carry burning embers for dozens of miles, creating spot fires that can create dangerous new wildfires. Like volcanic eruptions, these clouds generate a rapid rise in air, creating winds from all directions that fuel the fire. Fire tornadoes are cyclones of hot, fiery air that rapidly consume anything in its path. In California's Carr Fire, near the city of Redding, fire tornadoes clocked at 143 miles per hour, the equivalent of an EF3 tornado, were observed. Of course, these intense fire tornadoes can cause wind damage as well, rapidly spreading the fires and destroying anything in its path. Drought produced by climate change has also caused major problems for rivers across the globe. Numerous rivers in Europe are at record lows. River cruises have been halted on the Elbe and Danube several times in recent years. The giant Colorado River, a lifeline for the western U.S., has experienced a 20-year drought and is at a record low. Once flowing magnificently into the Sea of Cortez, the Colorado has not reached the ocean in decades. The Rio Grande is at a record low level, causing major problems in both Mexico and the U.S. Near Veracruz, Mexico, drought and aquifer depletion have caused 3 rivers to disappear entirely. In Colombia, red alerts have been declared due to low water levels in Magdalena and Cacao rivers. In Brazil, Chile, and Argentina are experiencing major water deficits. Amazonia, northern Brazil, Central America, and parts of Mexico are in a persistent drought with no end in sight. Of particular concern is the prospect of more frequent extreme droughts in the Amazon, which could push the region to a tipping point, increasing the likelihood of a large-scale dieback of the Amazon forest, producing even more carbon dioxide and, in turn, more global warming. The solution to slowing or even stopping climate change and maintaining a sustainable global climate is within our reach. Quickly, we need to phase out the use of fossil fuels, including oil, natural gas, and coal. They are extremely dangerous to human health and the primary cause of climate change. Electricity needs to be generated by solar, wind, geothermal, tide power, and hydroelectric. These technologies can be implemented centrally in large carbon-free power projects. They can also be done individually by installing solar panels or windmills at our home. Innovations in battery technology that permit the storage of large amounts of electricity is also imperative. We need to move quickly to hybrid cars and electric cars, as well as pollution-free cars that burn hydrogen, which produces just one major waste product, water. Cities should build increased mass transportation, trains, subways, monorail, and non-polluting buses. Neighborhoods should be more pedestrian-friendly, and bike lanes should be constructed in all cities. These changes are not optional. Our lives and the lives of our children and grandchildren hang in the balance. Throughout the world, a debate has erupted over whether or not health care is a human right. While that debate is beyond the scope of this discussion, clearly, sustainability requires control, if not eradication, of two types of disease: contagious diseases and chronic preventable diseases. Globally, we have made great progress in eradicating numerous contagious diseases. One good example is smallpox. For thousands of years, smallpox was a dreaded disease, nearly destroying many communities and even countries around the world. Thankfully, the last naturally occurring outbreak of smallpox in the United States was in 1949. In 1980, the World Health Assembly declared smallpox eliminated, and no cases of naturally occurring smallpox have happened since 1980. Thanks to vaccination and immunization, many other contagious diseases are rare or have disappeared entirely. Getting an entire population inoculated or vaccinated is the best way to eradicate contagious diseases. But even if nearly everyone is immunized against a disease, it has difficulty spreading to other people due to a process called herd immunity or community immunity. People who fail to get immunized but never get sick are termed freeloaders because they benefit from herd immunity without having taken personal responsibility for immunization. But people without inoculations are still somewhat at risk if they encounter another sick person who has not been immunized. Encouraging everyone to inoculate against common contagious diseases is one of the most important aspects of sustainability in human health. Sadly, many contagious diseases that could be cured through proven vaccines still afflict parts of the world. Surprisingly, common flu viruses are a major killer around the world. An estimated 500,000 people die each year from the flu. Unfortunately, the vast majority of people could be saved by getting their annual flu shot. This should be a priority in every country. Flu deaths occur throughout the world, but fatalities are particularly common almost everywhere in Africa, but also fairly high in New Guinea, Peru, Haiti, and Bolivia. These should be priority areas for international flu vaccination campaigns. Tuberculosis, which can be prevented with one of several vaccinations, continues to be particularly rampant in virtually all of Africa, but also problematic in Afghanistan, Laos, Cambodia, New Guinea, Bangladesh, Myanmar, North Korea, Indonesia, and India. Diarrheal diseases are the second leading cause of death in children. This is unfortunate because diarrheal diseases are preventable with safe drinking water, the use of improved sanitation, and hand washing with soap. Diarrheal disease is also treatable with oral rehydration solution, ORS, a solution of clean water, sugar, and salt and medication. Once again, virtually every country in Africa has a major problem with these diseases, as does New Guinea, Nepal, India, and Indonesia. A global priority should be clean water and soap for people in countries afflicted with these diseases. At the top of the list of dangerous but largely preventable diseases are mosquito-borne diseases. Malaria is one of the most widespread and dangerous diseases in the world. Malaria is a life-threatening disease caused by parasites that are transmitted through the bites of the infected female Anopheles mosquito of 5 species. Malaria is preventable and curable. In 2018, there was an estimated 216 million cases of malaria in 91 countries, an increase of 5 million over 2015. Malaria deaths reached 445,000 in 2016, a similar number, 446,000 to 2015. According to the World Health Organization, the African region carries a disproportionately high share of the global malaria burden. In 2016, the region was home to 90% of malaria cases and 91% of malaria deaths. Total funding for malaria control and elimination reached an estimated $2.7 billion in US dollars in 2016. Contributions from governments of endemic countries amounted to 800 million US dollars, representing 31% of the funding. Malaria is an acute febrile disease. In a non-immune individual, symptoms usually appear 10 to 15 days after the infected mosquito bite. The first symptoms, fever, headache, and chills, may be difficult to recognize as malaria. If not treated within 24 hours, malaria can progress to severe illness, often leading to death. Children with severe malaria frequently develop one or more of the following symptoms: severe anemia, respiratory distress in relation to metabolic acidosis, or cerebral malaria. In adults, multi-organ involvement is also frequent. In malaria endemic areas, people may develop partial immunity, allowing asymptomatic infections to occur. In 2016, nearly half of the world's population was at risk for malaria. Most malaria cases and deaths occur in sub-Saharan Africa. However, the World Health Organization regions of Southeast Asia, Eastern Mediterranean, Western Pacific, and the Americas are also at risk. In 2016, 91 countries and areas had ongoing malaria transmission. Some population groups are at considerably higher risk of contracting malaria and developing severe disease than others. These include infants, children under 5 years of age, pregnant women, and patients with HIV/AIDS, as well as non-immune migrants and mobile populations and travelers. Malaria remains a major killer of children under 5 years old, taking the life of a child every 2 minutes. Mosquito control is the main way to prevent and reduce malaria transmission. If mosquito control interventions within an area is high enough, a measure of protection will be conferred across an entire community. The World Health Organization recommends protection for all people at risk of malaria through effective malaria vector control. 2 forms of vector control: insecticide-treated mosquito nets and indoor residual spraying are effective in a wide range of circumstances. Anti-malarial medicines can also be used to prevent malaria. For travelers, malaria can be prevented through chemoprophylaxis, which suppresses the blood stage of malaria infections, thereby preventing malarial disease. The World Health Organization recommended seasonal malaria chemoprevention as an additional malaria prevention strategy for areas of the sub-Saharan region of Africa. The strategy involves the administration of monthly courses of quinine and sulfa to all children under 5 years of age during the high transmission season. In the years just before 2000, around 1 million deaths occurred in the world each year. By 2015, less than 500,000 lives were claimed by malaria. Most deaths still occur in Africa, where mosquitoes are abundant and healthcare is minimal. Fortunately, malaria deaths in Latin America have dropped considerably in the last decade, particularly in Brazil, Honduras, and Paraguay. And the number of cases is declining. Across all the Americas, increased prevention and control of malaria has led to a nearly 70% drop in cases, from 1.2 million in 2000 to 375,000 in 2014. But malaria is only one of several dangerous mosquito-borne diseases. In 2015, the Zika virus quickly exploded in warm tropical regions of the world. This was a particularly extensive problem in the Caribbean, Central America, and South America. This disease was principally problematic because of the numerous neurological problems in adults, children, and particularly unborn infants. In adults, Zika was associated with Guillain-Barré syndrome, a polio-like disease, mental fogginess, and fatigue. In infants, Zika was associated with microencephaly, a failure of the brain to grow properly, that left thousands of infants severely handicapped for life. This epidemic caused the World Health Organization to declare an international public health emergency in 2015 to 2016. The United States Center for Disease Control and Prevention, the CDC, is also leading global efforts to control these viruses, which are endemic in Puerto Rico and the U.S. Virgin Islands. Fortunately, comparatively few Zika cases were reported in 2017. Intense mosquito eradication efforts may have helped. Also, Zika may be like measles or chickenpox. Once you get it, you're not going to get it again. So the 2016 epidemic may have created some herd immunity. However, we should not be complacent. A few isolated Zika cases are still being reported in many places like Puerto Rico and the Caribbean, Mexico, Central America, South America, and most of Southern and Southeast Asia, and all of the countries of sub-Saharan Africa. This is not the rampant epidemic of 2 years ago, but caution is still advised. Moreover, experts agree that Zika will make a comeback. The question is when and where. The Aedes aegypti mosquito that carried the Zika virus is definitely not gone. The Aedes aegypti mosquito carries many diseases similar to Zika called flaviviruses, including chikungunya and dengue fever, also spread mostly in the Caribbean and Central and South America. Chikungunya, with rarely lethal, causes high fever, headache, severe joint and muscle pain that can persist for many months. Annually, there are nearly 1 million cases of chikungunya in the Americas. It is estimated that it involves about 4 out of every 1,000 people in the Americas and the Caribbean. So it is a major, widespread problem. Dengue fever causes a range of symptoms, from high fever, headache, and extreme joint pain, to severe symptoms such as organ impairment, coma, and death. 1,200 deaths occurred in 2015 in the Americas. Fortunately, in areas with the Aedes aegypti mosquito, protection is fairly easy. It starts with clothing, a hat, and mosquito repellent. One final area of sustainability that people need to be conscious of is political and institutional sustainability. It is imperative to preserve and improve the political and social institution of countries around the world. It is essential that countries permit free speech, dissent, free press, democratic elections, racial equality, and respect for human life. Unfortunately, according to Human Rights Watch, Amnesty International, and the Economist Intelligence Unit, many countries throughout the world failed to ensure these basic human rights. It is important that citizens of each country work to defeat totalitarianism, racism, and injustice, to install sustainably governments that assure basic civil rights, free speech, and racial justice. In the Americas and the Caribbean, they are present in Venezuela, Cuba, Guatemala, and Nicaragua. In Asia, repressive regimes rule in Afghanistan, China, Kazakhstan, Myanmar, North Korea, Turkmenistan, Vietnam, and Uzbekistan. In the Middle East, they exist in Iran, Oman, Saudi Arabia, Syria, Turkey, and Yemen. In Oceania, Papua New Guinea and Philippines have repressive regimes. In Africa, unsustainable, undemocratic countries include Algeria, Angola, Bissau, Chad, the Central African Republic, the Congo Republic, the Democratic Republic of the Congo, Ethiopia, Gabon, Guinea, Libya, Mali, Mauritania, South Sudan, Sudan, Togo, and Zimbabwe. In Europe, repressive governments rule in Belarus and the Soviet Union. But many European Union governments have begun to be much more repressive to immigrants, refugees, and ethnic minorities. Around the world, 77 countries have border walls, a dangerous sign of nationalism, racism, oppression, and fear. Most have been erected in the past 2 decades. At one time, U.S. President Ronald Reagan implored East Germany to tear down the wall that separated East and West Berlin. Now the United States is building a border wall with Mexico. Indeed, the Trump administration of the United States has made this country more repressive toward immigrants, free travel, refugees, women, and ethnic minority. In reality, many more repressive practices exist beyond these included on the list. Sustainable democratic institutions that ensure equal rights for all citizens require the constant work on the part of citizens. An essential part of sustainable governments is the right to free speech and dissent, free elections, and a peaceful transition of government political power. Mexico should be applauded for a peaceful transition of power to a new political party in 2018. Throughout the world, the development of sustainable governments with an open and sound economy, free institution, and equal rights for all its people is important work. Beyond the day-to-day duties of making a living and raising our families, we must all devote time and energy to building tolerant and sustainable institutions and communities. Thank you.